Okay, so it is December 7th, 2017. Time flies when you're having fun, I guess. And there's some things I want to go over because people have questions. And if you have any questions, you can interrupt me anytime and ask the question, whatever you have. So uh, don't be shy. Remember, we are recorded and this is going to be posted on Facebook. So if you are shy and you don't want your name up in your voice, then you can certainly email me for next week. Or if there's a bunch, sometimes I make an extra video like I did last week since I was gone. So make sure you watch that. I always post that on Facebook as well. All right, so we're going to talk about thermography today because I like thermography and it gives us some valuable information. And I think the more you know, the better you can use that information and help you. So a couple of things about the unit that we have. We use the Meditherm. So if you go anywhere else, because we see obviously patients from all over the world, and in the United States, I don't know where they are elsewhere outside of the United States, but in the United States, there's multiple different thermography units. I'd suggest you only go somewhere that uses the Meditherm. That's just my suggestion. And yes, I'm a little biased, but it is the one that's FDA approved. And they do have a system that at least all the data is stored in the cloud in their banks. So if you come here and do thermography one time and then you go somewhere else and do thermography with a Meditherm practitioner, um, the radiologists who review it could compare studies between the two clinics, even though they're in different parts of the country. So there's some benefits that way. We also have access to thermography that's done elsewhere. So that's a benefit. And plus you just get you get more objective with comparing studies. It makes it more accurate. Um, we're going to talk about accuracy of thermography and when you're comparing a 3-month study and 6-month study. There is discrepancy in that no matter what you do. And we're trying to, our clinic is actually trying to make things better for the whole Meditherm community because we have some ideas that we're going to be implementing in the clinic to make it a more of an objective test on subsequent tests. So Meditherm clinics are all over. You can find them if you just search meditherm.com and locate a clinic near you. Most large cities have somebody that's doing Meditherm in it, or close by, or that will travel. All right, so let's get started. So why do you do thermography? Does it diagnose? How does it help us? What's the purpose in it? Well, remember, thermography is taking a picture of heat. So that's what it's looking at, is heat. So it isn't diagnosing cancer. It isn't diagnosing disease. All it's telling us is where are there hot spots and or cold spots. So it's looking at the heat differentiation. And I'm not going to get into the technicalities of the point, what 0 point temperature differentiation in colors. But bottom line, it's telling us where is there hot spots, where is there cool spots, because both hot spots and cool spots could tell us something, could give us hints to something. Again, it's not diagnosing, but it's giving us hints to something. So in a picture like this, you see this is a person's breast, their left breast. They got a lot of hot spots along this breast. Does that mean that they have cancer there? No, it doesn't. It means they have a lot of hot spots along that breast. And then you have to take clinical correlation based upon that. What would produce heat in a person's body? Well, an infection could produce heat. An infection would produce heat if it's an active infection. irritation of some kind would produce heat. So a person would have a picture like this if they took their finger and they poked themselves there multiple times, poke, 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 and then they took the picture because you just irritated the tissue there. That's why we have those rules before you do the thermography, that you're not, putting lotion on your body, you're not scratching yourself, you're not doing a heavy, deep massage the night before, something like that. So we don't want, that would be considered what's called an artifact. We don't want artifacts, meaning um, incorrect abnormalities or false positives. This would be if somebody had this redness here because they just scratched their skin really, really, really hard and then they took a picture. Well, that should give us a false positive. It'd probably look much different than this, though, because it would look right where you scratched, and it wouldn't follow a line like this unless you did a weird scratching position or something like that. But we want to be as accurate as possible. So you try to take those precautions as far as preparation goes. And that's where there can be inaccuracies. Because thermography is so sensitive, it's going to pick up heat. For instance, this heat in the armpits here. What is that from? Does that mean this person has a malignancy in their armpit? Well, of course not. So you take clinical correlation. This person walked in the office with their arms down, and they're going to have more heat in their armpit. Now, this person has heat underneath their breast. Is that abnormal? No, they probably walked in wearing a bra, so they had irritation from the underwire of the bra, and their breasts, okay, sag down a little bit like this, and we're putting pressure, so you had skin-on-skin pressure there. You're going to have more heat. So this would be a normal finding of red right in here. This would be a normal finding of heat in the armpits. Even in the lymph nodes here, draining. This is the lymph that drains the neck. Obviously, we cut off the picture of the person's head here. But is this normal? Is this abnormal? It depends on what's going on with the person. So let's say this person, oh, I just had a really bad cold last week. Then this would be considered normal. So it doesn't mean it's a disease process. So, and then when you look at the body, when you look at the body with thermography, you split the body straight down the middle and you compare left to right. Everything you do that with except the breasts. So the breasts are considered separate organs in themselves, and this could actually be a normal picture of this person's breast. So that's why you do a 3-month follow-up. So let's say this person has no history of breast cancer. They're just coming in to do their first thermography, and this is what the thermography looks like. Well, this would probably be rated at some risk here because there is heat there. We don't know what is going on there. Should the person go and get mammography? Well, in my opinion, no. Should the person go get an ultrasound? Maybe. Should this person be doing regular breast exams, palpatory? Yes. But then you'd want to get a 3-month follow-up. If it looks the same at 3 months, this might be the person's normal. I would suggest getting another follow-up maybe in 6 months. It looks the same, and it continues to look the same over a period of time. This may be this person's normal. So you're comparing studies over time. Well, if this is the person's first picture, then this is all we got to go by. And then you have to correlate it back to other clinical data. So you're just using a thermography like you'd use any other test to help you with differential diagnosis with the patient that goes along with other clinical data and examination and other clinical testing that may give us some information on what's going on with the patient. All we know is that there's heat there. You also look at spots that are cooler, like this could be a cyst right under here, a breast cyst, because they got a very circular cool spot around the red. So you see these odd little shapes like this, that's very possible that that's a cyst. But again, you're not making a diagnosis off of the thermography. You're getting some hints. always with the thermography, the red is hot, the white is the hottest, and it goes down to blue. So this is a cooler spot here amongst this heat here, and a circular cooler spot, you'd think there's a possibility of a cyst there. So it gives us hints. All tests do is give us clues, even blood work. Remember, oh, I had an abnormal vitamin D level. Well, really, what's abnormal? Well, this is the normal range. Well, yeah, that's the normal range. That's a range for a reason. People say, well, I'm running a fever. What's your temperature? 99. Well, have you ever taken your temperature before? Yeah, it always runs a little high. Well, that could be your normal. 98.6 is just the average. So people can be, you're unique. And we don't want to compare you to a given norm that this is what your value should be. Cholesterol is a perfect example of that. When I went to school, normal cholesterol was 220 or below. Well, then when they came out with statin drugs, they decided, and I'm not kidding here, they decided that they could have 80 million more people on statin drugs if they lowered the normal. So they lowered the normal to 180 so that then they could prescribe statin drugs for everybody that's over 180. Now, to me, that's absolutely criminal. That's just absolutely criminal. Besides the fact that statin drugs completely deplete your CoQ10 and increase fatty liver and a whole bunch of other side effects of statin drugs, minus the fact that having cholesterol of 220 in my book would be considered normal because cholesterol is needed to convert to vitamin D in the skin when it's hit with sunlight. So a big part of the reason why people are so deficient in vitamin D is they're trying to keep their cholesterol levels artificially low using statin drugs, pushing their cholesterol down. They don't have 25 hydroxycholesterol in the skin that converts to vitamin D with sunlight. And we have a spike of cancer. It's certainly a contributor to our increase in cancer rates. So it's just what is supposed to be normal. Yeah, if you have cholesterol over 300, that's a hint that something's going on with your liver. We need to correct that. But you don't correct the problem with the liver by artificially manipulating the cholesterol down with the Lipitor. So be careful of what normals are. And we have to compare you with you over time. And if you do have some things that look funny and abnormal, then we compare that with other clinical data to get to the root of it to help correct the problem. Just like with cholesterol, we still wouldn't use Lipitor to lower the cholesterol level if you're at 325. We'd find out why you're at 325 and help flush the liver. Here's some other pictures that show different things. So this says healthy symmetry of breast. This isn't my typing on here. I stole this all off the internet. But really, you're not looking so much for symmetry of breast. Like, oh, look at how the coloration is almost identical between these two breasts. That's really not what you're looking for. People can have very abnormal coloration between two sides of their breasts, because remember, the breasts are separate organs. But if you have some major discrepancy like this picture, you'd think something's probably going on. We got some hints that something's going on. Here's a major discrepancy between this person's breasts. Something's going on here. We need to look deeper. If this is the person's first time, obviously this isn't the person's first time. You can see the breast is much larger here than this one. They already know something is going on. But then you can use this picture over the course of treatment and see how that changes. It's just another clue to improvement or going the wrong way. That's why you do subsequent testing. Typically, or just to just technically, they always, thermography has got some kind of rules. One of the rules is you really want to get a 3-4 month baseline, meaning if after your initial thermography you want to get another one, they say 3 months. It depends on where you're at if you can get to a thermography clinic. And then at 6 months, then at 9 months. And you're looking at progression of a disease here, and you can see some changes. Here's some heat in this person's right breast here. This could be completely normal. We see it a little bit more here. That starts to get suspicious. We see it a little more here. Now, personally, I wouldn't just do this and not do some other inspection, whether it be a kinesiology exam or an ultrasound or palpatory exam or whatever you're going to do. You might want to look into it when it's at this level, not when it's at, wow, I guess this is really progressing way down here at 9 months. But this is how a disease would progress over time. So it gives us a picture over time of what's going on, and then it hints on what we need to look for to help make some intervention. Also, there's other things you look at. So here's a picture of a person's feet, obviously. There's really hot spots. Remember, white's the hottest here. Would this be considered normal? Maybe. Again, you have to assess it with other clinical data. Maybe this person, how far did they walk coming in the office? How did you have them sit and have their feet up for a half hour before you took this picture? All these things are important to assess when you're really making a decision on, is this normal or is this normal for the person? If the person has a lot of pain in their feet, and that's what you're assessing, then you'd look for, are there hot spots in the feet that could be causing some problems and causing that person's pain? Did somebody have a question? Last week we talked about on the video that I made about dental infections. Heat around the mouth is never normal. So I said that heat in the sinuses that will be listed on your report as abnormal. Many times that can be normal. People have allergies, people have other issues, and they can have some heat in the sinuses. Especially women that pull their hair back and they did their hair and such, you're going to have heat around the hairline. Heat around the mouth is never going to be normal. So there's something going on there. And like I said in the video last week, that many times this is where thermography really shines, to find these little hidden infections that can cause a lot of problems. As I stated, hidden, subclinical, meaning you have no symptoms of any tooth pain. Subclinical dental infections can cause heart disease, can cause cancer, can cause all sorts of problems. So finding it on a thermography scan before you have any symptoms can be really nice to start treating it. Other muscular issues you can see on a thermography. A cold area over the heart can give you hints of cardiovascular disease. So there's lots of benefits. What's really common that we see is really cold areas on the feet, or the toes are completely gone. So I did thermography on myself, and I should have pulled that picture. It was a front to back picture. My left foot, you could not even see. I dialed it in. We were playing with it. I dialed it in so you could see all of my right foot. You could not see the toes, and the whole half of my left foot was gone. I thought, what the heck? So I knew, and I didn't have any symptoms. I have zero symptoms of pain in my left foot, but I do have a history of years ago. I broke my fibula and sprained my left ankle really bad multiple times in sports. So I thought, what the heck? I don't have any symptoms of foot pain. Well, it was about 8 months later, I started getting pain and neuropathy in 2 of my toes on my left foot. Now, I corrected it with the PEMF, but I should have done the PEMF right away. But I thought, oh, I just forgot about it. I got too busy. But you can see neuropathy issues before the person even has problems. And I'll tell you right now, I have many friends of mine that are doctors that are functional neurologists, because I have a degree in that also, so I belong to several groups of functional neurology doctors that all they do is treat neuropathy. There are so many people with neuropathy. Neuropathy, actually, the leading cause of death of people over, I think it's 70 something, is falling because they can't feel their feet anymore. So they don't know where their feet are in space, and they're tripping and they're falling. So neuropathy is a really bad problem. Neuropathy is a bad problem with chemically induced neuropathy with chemotherapy patients, but it's certainly a problem with diabetic patients with neuropathy, because the high blood sugars burn out the large diameter afferent nerves. But it's a problem throughout society. So looking at a thermographic image, you can see like this person definitely has neuropathy going on in their feet already. They also have a possibility of a clot here. So that redness, that red streak, this isn't a real great picture here because they blew it up. That white spot right there could be a blood clot in their leg. So seeing vascular issues with thermography is very identifiable. So it becomes very beneficial for people with that. Abdominal issues. Here's a great picture right here. So I would ignore the heat, the increased heat right along here, because this is probably where the patient's pants line was. That's why it's real hot right in here. But this heat all over here, up in here, this is underneath this person's breast, so I would ignore this heat right here. I would say this person probably has some constipation issues, maybe some colitis issues, maybe some liver issues right here. This you could say possibly the spleen, but I would correlate it back to any symptoms the person has, because this could be the flexure from the transverse to the descending colon here that we're picking up. This person definitely has got either liver, gallbladder, or pancreatic issues right here for sure. This could be bleeding from that because this is so hot. This could be all liver, gallbladder, or pancreas. Now, yes, could it be a stomach issue? Possibly. Duodenal? Possibly. So you got to relate it back and correlate it to other clinical findings. So thermography in itself is not going to be determinant of any disease by itself. So you relate it back to other clinical findings. Any other questions on thermography? Because I got another subject I want to go over.
Dr. Connors, this is Dave Lopez out in Massachusetts. What should one look for in looking for a local clinic that does thermography? What should we be looking for when it's that time?
Okay, so look for a clinic that does Meditherm. So you might have jumped in a little bit later, but it's the Meditherm clinic that you want to look for. And you can call our office and ask our office too. They could go on the Meditherm website, but you can look up the Meditherm website in a clinic near you. Where you're located, you'll for sure find somebody that has a Meditherm unit there for sure.
Well, thanks. I did dial in just a little bit later, but yeah, I missed the very first part. But thank you for that.
Yeah, and then you'll probably want to do another whole body too.
Top to bottom?
Yeah, we did a whole body on you, I believe, and you'd want to do that.
Right. Actually, we did just from the waist up for me.
Okay, so we did an upper body on you, so do the same thing that we did.
Okay. All right. Thank you.
Any other thermography questions? Okay, another question that we get is alkalizing. I want to alkalize my body because, I mean, it's all over the internet, right? I got cancer and I want to alkalize my body. So we want to cover some of the myths and the realities of alkalizing, because there's some misunderstandings about this. So how do you alkalize your body? Do you want to alkalize your body? What's the purpose of that, and what's the purpose with cancer? And I've said multiple times, if you read any of my information, that you alkalize, there's information out there is that cancer can't grow in an alkaline environment, and the reason why you have cancer is because you're acidic. Well, I would argue strongly against that topic. The cancer itself, because it's rapidly replicating, is going to produce a lot of lactic acid that's going to spill over outside of the cancer in the milieu that surrounds this growing mass, and that is acidic. So cancer itself, by rapidly replicating, is producing an acidic slime layer around itself. And unfortunately, that ends up becoming protective for the cancer, because the T cells, your immune cells, sometimes it makes it more difficult for them to penetrate it. So yes, cancer itself is acidic. Did it grow because it was acidic? No. It grew and it created more acid. Now, in multiple other videos, I talk about glycolysis. That's the process of you utilizing glucose. So all your cells take in glucose. It goes through a process of glycolysis, and then at the end point of glycolysis is pyruvate. Pyruvate then is converted into a chemical called acetyl coenzyme A, which then goes into the mitochondria, into the Krebs cycle, and produces a lot of ATP, energy. That's really how your cells produce energy. With cancer cells, they like to survive by eliminating mitochondrial function, and they survive off of lactic acid. And what I talk about in multiple of my genetic videos is that, especially if there's a gene that helps convert pyruvate into acetyl coenzyme A. If I have a lot of defects in my PDH genes, in my HIF1A genes, then I will even be more prone to produce lactic acid from pyruvate instead of acetyl coenzyme A. That's the cancer that feeds off of glycolysis, and people that have those defects are going to be much more prone to feed off of glycolysis and lactic acid, will have a greater degree of acidity around their cancer. The cancers will tend to be a little bit more aggressive, and these are the patients that we put on a more ketogenic diet. Now understand, all cancer is going to feed off of glucose to some degree. So that's why we don't want anybody eating a lot of sugar. I mean, sugar should just be out of the question for any cancer patient. But there's some, because of the specific defects that they have, their cancer is going to feed directly off of lactic acid, and those are the people that we tend to put on a more ketogenic diet. Typically, they're fit into more of the brain cancers, some of the breast cancers, some of the other cancers. So the cancer is producing an acidity. So is it good to alkalize our cells? How do we do that? The answer is yes, it's good to alkalize our cells. How do we do that? And can we measure my degree of alkalinity? So you can read some books and a lot of websites that will tell you to get a pH strip and to stick it in your mouth and measure your saliva or measure your urine to see if you're acid or alkaline. Now, the problem with that is you have to understand some basic physiology. If I have cancer in my colon or my breast or my brain, the cancer and around the cancer is what is acidic. That's what's acidic. It's not going to make my urine more acidic, nor is it going to make my saliva more acidic. Your body has what is called a buffering system, and it buffers the acid alkaline base so that you don't become too acidic or too alkaline. Your blood will never vary more than about 0.1 from a 7.4 pH, or you will be dead. So it is total physiological impossibility for a cancer patient to measure, or any person to measure their urine or saliva and say, wow, I'm more acidic or I'm more alkaline systemically. No, your urine is more acidic or your urine is more alkaline, or your saliva is more acidic or more alkaline than yesterday, but it really has nothing to do with the cancer. So unfortunately, though, we'd like an easy way to measure acidity and alkalinity around a cancer. You just have to understand physiology. It's not measurable unless we cut you open and stick a pH strip in you. And even if we did that, it would change the pH because we just introduced oxygen to the component. So you cannot measure it. Matter of fact, you could get confused, and it can be complicated if you're trying to measure urine pH or salivary pH and think that that equates to any sort or any way of systemic pH. It just does not make any physiological sense. So there is misinformation about that. I don't see any value in checking urine pH. If I just take a bunch of minerals, I will spill them into the urine and my urine pH will go up, and I will believe that my body is more alkaline. But all it is I just made my urine more alkaline. However, there are certain things that we need to do to alkalize ourselves. So alkalizing our body is very helpful, because that acidic slime layer around the cancer does a lot of bad things. It stimulates the release of what's called matrix metalloproteases, which is an enzyme that breaks down the extracellular matrix. Extra, outside, cellular. So that which is outside the cell, between the cells, is not just a fluid, it's a matrix. And when the metalloproteases that are released by the cancer break down the proteins in the extracellular matrix and allow the cancer just to like take hold. That's the benefit of taking enzymes also. So some of you people I have on a high enzyme therapy, because with kinesiology that tested out. The enzymes will help root that out and break that up. Also, the lactic acid stimulates the release of more cancer growth factors, stimulates angiogenesis, which means angiogenesis increases blood vessel growth into the cancer. And lactic acid has been found to directly inhibit your T cells. I already talked about that. So how do we alkalize ourselves? It has everything to do with our diet. It's not measurable. We just have to eat the right diet. So all these things on this list are actually good for you, but here's more highly alkaline things, more green. The thing is, typically, it's going to be more alkalizing to you, typically. This list here is a better list. These are more acidifying. So meats, even though it's okay to eat some meat once in a while, they are acidifying. So remember, it's not whether that thing is acid in itself, it's what it does to our cells. So this is another misconception. Okay, so I don't want to step any toes here of you that may be out there that already have a water system that alkalizes your water. So is drinking alkaline water beneficial for us? Well, fine, drink alkaline water, but not with your meals. So if you have a water alkalizer, drink alkaline water, but not with your meals. You'd be better off if you put some lemon in your water, or you ate a good diet with a lot of vegetation, than you would be thinking you're going to buy a water alkalizer that's going to make you really healthy. So understand, our stomach is the only place in our body that we want to keep extremely acid, especially when we're eating. Our stomach acid is responsible for breaking down carbohydrates. That's the process of digestion. So digestion is the process of breaking down a food. Carbohydrates are broken down by the HCl secreted by my gastric cells. Proteins are broken down by the enzymes secreted by my pancreas into the small intestine. Fats are broken down by bile secreted by my liver stored in my gallbladder. So if I don't have HCl, hydrochloric acid, in my stomach, if I'm not keeping my stomach acidic, I won't break down my carbohydrates. I'm going to put more stress on my intestines. That's going to cause more gut issues, and that could be a problem. So so what do I want to do? So should I drink alkaline water? Should I drink sodium bicarbonate? Well, if you do that, make sure you don't do that with any food, because you need acid stomach when you consume food. You need to break down your carbs. So you look on this list, look at lemons and limes. If I stuck a pH strip in this lemon, would it be acidic or would it be alkaline? The pH strip on this lemon will probably be about 2.3 or something like that, extremely acidic. So it's not the fact that this is acidic, it's what that substance does once you digest it and absorb it, what it does in your body. Is it alkalizing to your body or is it acidifying to your body? I've never tried it, but if you stuck a pH strip in honey, I don't know if it would be acidic or alkaline. It might be even alkaline. I bet you $100 that if you stuck a pH strip in dairy, it would be alkaline because there's a lot of calcium in it. So it's not that that is alkaline or acid, it's what it does to your body. It's acidifying to your body. So it's not whether the substance is alkaline or acid, is the substance acidifying to your body, because as your body breaks it down, what does it do in the tissues? Or is it alkalizing to your body? Because as the body breaks it down, what does it do in your tissues? A big reason why these things are very alkalizing is because the amount of enzymes in them.
You say coffee is acidifying. How would that relate to doing the enemas?
So it doesn't mean you're not eating or consuming any of these things. But if I'm drinking 6 cups of coffee a day and that's my major source of beverage, that's not really great for my body. Now I can offset it by if I am eating mainly a vegetable diet and I'm not eating any meats. So it's just about balance. It doesn't mean that you won't ever eat grains. I have a lot of people eating grains because we need to keep their weight on. Now they're acidifying, but we're also eating a lot of vegetables too. So it's about that balance. Coffee is acidifying, but again, the coffee in a coffee enema, you're not absorbing a whole lot of that coffee. So you're doing the coffee enema in order to stimulate the parasympathetic system, and then you're expelling most of the coffee. So you're not actually absorbing it, so it's much less acidifying to your system. Any other questions about alkaline acid? Because I know there's a lot of misunderstandings about this out there on the internet.
Dr. Connors, is David once again. I'm not sure if this is related, but what happens when someone doesn't masticate their food properly? Some people just eat really, really fast. I'm a slow eater, so I masticate pretty well, but some people eat really, really fast. And what happens digestion-wise in relation to what you're talking about?
Right. So my dog is a perfect example of that. I gave him a piece of salami the other day, and she swallowed it whole, I swear. So, exactly. So if you don't, okay, so the process of mastication, you're chewing your food. This is another little tidbit. Is it a good idea to chew gum? No, it's not a good idea to chew gum very often. You do it once in a while, fine. But chewing gum, you're telling your stomach that you got food coming and you don't have any food coming, so you're releasing hydrochloric acid in your gut where you're not going to have anything to break down and you could end up hurting your gut.
Mm.
So the process of chewing your food stimulates hydrochloric acid production in your stomach. And remember, there's two processes in getting nutrition out of your food: digestion and absorption. So the
Mm.
process of chewing your food, you're breaking down the food physically, obviously, into smaller components. Also, your salivary gland is releasing ptyalin, which also helps break down mainly carbohydrates. So you're partially breaking down carbohydrates by chewing your food by the release of ptyalin from your salivary gland. And then you're swallowing it, so you're saving, you're really helping taking stress off of, because you're chewing all your food, off of your stomach, your HCl, and your pancreas. So chewing your food, especially for carbohydrates and proteins, is very important. So your mom used to say to chew your food 30 times before you swallow it. There's a lot of truth to that. Eat slower and chew your food. Good question.
Yeah, I do choose my food, and I've done that for a long time. But I am around others who chew really fast and swallow. I mean, they finish their plate long before I can go halfway through my own plate. But for those people, I'm just curious, for those people who eat like that, is there a weight issue? Does that cause more weight in the body later on through digestion or that
No,
process?
only indirectly, because what it's going to do is it's going to cause a lot more stress on the intestinal tract, because you got food going, you know, the food sits in your stomach, it's supposed to be digested. This is the same problem with people that have too little HCl, which is about almost everybody.
Yeah.
And then it's secreted into the small intestine, only partially digested, and it just puts more stress on the whole intestinal tract, um, increases possibility of constipation. You're not going to absorb nearly as much nutrition, and the food that you will absorb will probably be the glucoses. So indirectly, can it add to weight? Yes, because the person would probably still be hungry and eat more, so
Mm.
they'll consume more calories, and they'll be absorbing most the most simplest thing to absorb, which will be the glucose. So they're going to be at a higher rate for um, diabetes, or at least syndrome X, having higher glucose levels, and that's certainly going to cause more problems.
Interesting. I have one other little question. You mentioned about the gum chewing. I do chew gum, and primarily just to keep I suppose my palate to my mouth lubricated. Is there an alternative I can look for?
Yeah, so alternative would be, have water in front of you all the time.
Yeah, and I usually carry water with me when I'm working or driving certainly. So it doesn't seem to quite satisfy me. After a few minutes, I find that my mouth is on the dry side again.
The other thing you could do is bring a small little jar of coconut oil with you,
Okay.
and take like a teaspoon of coconut oil every hour or something like that, and swash it around in your mouth, and to kind of suck on that a little bit. It's going to dissolve pretty immediately in your mouth, and then just kind of swash it around your mouth and swallow that. That will help lubricate your mouth so that you feel like you're not dry, and it's going to be a good fat for you.
Okay. All right. Oh,
Dr. I have a question about wheatgrass. Does that fall into a very high level of alkalizing? Because I hear just like
Yep.
it's the
So
best
wheatgrass would be a
food.
green. So you can think of just about anything that's going to be green is going to be alkalizing.
But is it really as amazing as, I'm hearing it's oxygenating, it's the most alkalizing form of...
No, not really. But I mean, you got to be careful and cushion anything that you're hearing a little bit. But it's good. Wheatgrass is great. Are you juicing it?
Masticating.
Okay. Yeah, wheatgrass is good. Is it tremendously better than any of the other grains? No. My belief is that you should get as big a variety as possible. You look at the studies like the Okinawa study where the people are living to 120 years old. The biggest thing that they found with them is, first of all, they're eating everything organic. Second of all, the variety of food that they're eating on a daily basis was mind-boggling. So, and they wouldn't eat any more. It just, let's say if they were going to have rice, they'd have a mixture of about 7 different types of rice. So in their vegetable mix, it would always be a mixture of a whole bunch of different vegetables. And that was the biggest surprise on that study. So um, that's why I like products like Greens First or a greens product, because you just can't even, how can you cook, you're trying to work a 40-hour week, and it's just hard to stay on top of this. So it just gives you, an advantage of getting some variety in there. But wheatgrass, doing that every day would be great.
And then just another quick question. Is there a good exhaustive list you can provide us of alkalizing versus acidic? Because I find a lot of contradictions when I go on the internet. Like, for example, oranges, I see them on both lists, and pineapple.
Yeah, the problem is that there's no perfect way to measure this. So, for instance, okay, meat is very acidifying, but if you're eating grass-fed, organic beef that you know where it came from and there's no GMOs in it, it moves a little bit farther over this way. Oh, salmon here, that's acidifying, but it's kind of, a little bit on the better side. But if you're eating farm-raised salmon, it moves way over on this side. So that's what makes it difficult. If you're drinking raw dairy, which I don't think anybody with cancer should be on dairy if you could help it, um, because it has growth factors in it and stimulates mTOR. But the average person, if they're drinking raw dairy from their own goats, let's say, it's going to be on this side. If they're buying milk in the store, it's going to be way over here. And remember, acidifying foods and alkalizing foods aren't the only things that we're looking for in a food. So just because grains are acidifying doesn't mean we should never eat grains, because the purpose in overall health isn't just to alkalize myself, and or to keep from being acidic either. So you got to take a little bit step back from just this talk, and we're not only looking at that. So there's obviously things, okay, whether this stuff down here, alcohol and fruit juice and soda, was alkalizing or acidifying, it's just not good for you, period. So that you got to kind of bring it all in balance. Easiest way to think about it without going nutso is your green vegetables are going to be the best thing for you. Eat as many of those as you can. Different ways to cook them and prepare them and juice them or whatever you're going to get them in you. Your lemons and limes are going to be alkalizing, but we don't want too much citrus either. And you need good fats. So your avocados, your coconut oil, coconut should really be on this list over here, are going to be alkalizing and are going to be good for you in a lot of different ways. Somebody else had a question there too.
Dr. Connors, this is Carol David's wife. When you were talking about the coconut oil and swishing that in your mouth, I thought if you had like some silver fillings, that wasn't such a great idea. Did I misunderstand that in the past?
No, so you're right. So I did bring that piece up. I don't know, remember, David, if you have silver fillings in your mouth. But you can still, so if you do have silver fillings in your mouth, you do not want to do oil pulling. That's what you're
Okay.
speaking about.
Exactly. Yes.
Oil pulling is putting a tablespoon of coconut oil in your mouth and swashing it around your mouth for 10 to 15 minutes and then spitting it out of the sink to hopefully pull the mercury and other metals out of your gums and through the buccal mucosa of your cheeks. But you can't do that if you have metal in your mouth. So if you do have metal in your mouth, yeah, maybe you shouldn't swish it around your whole mouth, but just trying to lubricate his mouth a little bit, not trying to pull metals. So if you put a tablespoon of coconut oil in your mouth, it'd be hard pressed to keep it in your mouth for more than a minute or so anyhow. But
Yes. Thank you for clarifying. I get it.
any other questions? We've gone, oh my gosh, we're on 53 minutes here. All right, so if anybody has any more questions, I'll answer them. Otherwise, make sure you email them to me. Anything?
I have a question about the Rife machine. If you can't finish a whole cycle through the night, is it okay? Like, does it do any harm to pause it and then finish it like later, like, the extra hour or two? Does that interrupt the
No, it
benefit?
doesn't. No, it doesn't change the benefit at all. Now understand, I made everybody's program a little bit longer than I think that they would stay in bed. So don't be so anal to think that, oh my gosh, I didn't finish my program. I got to get that finished. I don't want you to think that way.
So if there's an hour left, it's not that big of a deal.
If you're missing an hour every day, or more than an hour every day, then I will make sure you contact me and I will shorten your program. I'll decrease the dwell throughout the whole program so that we cut that back down. But I have different frequencies recycling themselves through that night. And that's the benefit of having 7 nights of programming. I typically program 8.5 to 9.5 hours, knowing that you're going to maybe only be in bed 7.5 hours. Just the reason why I do that is because, hey, if you're going to go to bed a little early, 1 night a week or 2 nights a week, you're just going to get more time.
Okay. Yeah, I hate running into the biggest problem. The longest cycle is on Saturday night, and that's usually the night when I go to bed later. And
see, I thought that's when you go to bed earlier and get caught up on your rest.
Saturday, no, that's
Partying. I
night.
get it. I get it. So we need to go back down to this alcohol piece down here for you, right?
It doesn't necessarily have to involve that. It's just
That's right. That's
staying
right.
up a little later because you went somewhere,
Family time.
Yeah.
You talked about in your book about vitamin C, and my doctor had asked about doing vitamin C IVs.
So our vitamin C IV is good thing to do. Yeah, there's a lot of data that shows that vitamin C IVs can be very beneficial for cancer patients. Vitamin C is a antioxidant, and there's benefits to antioxidant therapy. High dose vitamin C has been found to be oxidative. In that sense, it's directly killing the cancer. So just like chemotherapy is oxidative, it kills cancer and it kills cells. Well, why would I do that? I want antioxidants. Yes, but if we do a high dose of an oxidant, we will also kill cells, and it can be more specific to cells that are in rapid replication. So high dose vitamin C tends to act like chemotherapy in a sense. But in saying that, it can have some ill effects on your body too. So there are some negatives and precautions with vitamin C therapy. If you don't have a port, it can be very hard on your vessels. Some people worse than others. And so, but there's benefits as well. If you're considering doing that I should do some, just let me know, let the girls know, call the office that you're considering doing it so I could do some distance kinesiology, whether that's going to be the right thing to do for you, at least in my opinion. Does that sound fair?
Yes, thank you.
What about just vitamin C supplements? Like, wouldn't that be helpful at least to some degree?
It can. So if you're going to supplement with vitamin C, go back and watch my video on what are good vitamins, bad vitamins. So if we're going to supplement with vitamin C, we want to supplement with a whole food vitamin C. Because remember from that video that when vitamin C was first discovered, the microscopy available at the time of the scientist's discovery only showed the outer shell of the vitamin C, and he called it ascorbic acid. So vitamin C is hence now defined as ascorbic acid, which is easily made in a laboratory. We made it in biochemistry or organic chemistry class when I was in college. So that is vitamin C. However, that's not what vitamin C is in nature. A couple of years later, when microscopy has improved, they found out that, oh my gosh, that was just the outer shell. Vitamin C has all these other nutrients inside of it. Well, too bad it was already labeled. So you want to get a vitamin C that's a whole food vitamin C. There's not a lot of companies that make whole food vitamin C. Where do you get whole food vitamin C? Number one is from your food. So you're eating all this vegetation, you're getting a lot of vitamin C if you're buying organic vegetables. So you get more vitamin C in an orange or a carrot, probably in a carrot. So you get vitamin C in your vegetables. You can buy whole food vitamin C supplementation. Standard Process is one company that specializes in whole food since the 1930s. I think there's another one was Garden of Life that I used to recommend, but Garden of Life just got bought out by Nestle. So it's like, okay, I'm not using them anymore. So I'm a little prejudiced.
Got one more quick question. Are the new tests in, and what was the name of the new genetic test you're doing?
So the new genetic test, we can't release the name yet, and we're hoping to have it by next week. Yay. So that would be great.
I have a real quick question. Can you get vitamin D from the sun through a window?
Good question. The answer is no, I don't believe so. I think you need the beta waves, and I think the window blocks the beta waves.
About 80%.
Yeah.
It blocks a lot of it.
And remember, you can't get vitamin D. You don't produce vitamin D unless the sun is hitting your skin. And you have to have enough 25-hydroxycholesterol in your skin in order to make vitamin D from UV waves hitting your skin.
So if I'm taking my walk out in the winter and I'm all bundled up and only my face is sticking out,
You're not getting no. So you're going to have to walk in your bikini, whether it's cold or not. All right. Well, we better stop here because we're at an hour now and nobody's going to listen to this video. But hopefully you guys got a lot out of it.
Thank you.
And make sure if you have questions, email them to me because otherwise I don't know to address them. So about a half hour before each talk, I go, oh, what should I talk about today? So I quickly threw this thing together. So I'd rather talk about what you guys want me to talk about. So make sure you email me your interests.
Thanks, you.
Doc.
Okay, this will be up on Facebook. Thanks so much.
Thanks. Have a good night. You bet.
Bye-bye.
Bye.
Bye.